Thank you very much for joining us. We'll bring you the details of those stories later. But right now, let me take you to the Information Ministry for the bi-weekly news conference by the Information Minister. Currently speaking is the Director General of the Ghana Health Service, Dr. Patrick Kumabwaji.
We had 113 cases from Kumasi Metro and Sitre South. Bono East reported 89 cases from 7 districts. Majority of them from Techiman. Central Region reported 89 new cases from 7 districts. A majority were from Cape Coast and Aguna East. Western North has 67 new cases from 3 districts. Majority are Swamai and Awin districts. Both had 11 new cases from Ho and Ho West. East reported 4 new cases from Okuapim. OT 3 cases from KJB. The remaining 8 regions reported no case. That's Western, Upper West, Upper East, Northern did not report any case. If you look at the cumulative total and the records, you can see that the active case, as we mentioned, comes to about 30,505, and the majority of the active cases are currently in Accra with 2,159, Ashanti with 569, and Volta 132, among others. The rest are all in less than 100 or below. And that is shown graphically on your right to see where we have the more active cases in now currently in Bono, because they just received a new positives, Ashanti, Western, Greater Accra, and Volta region. The rest are quite fewer number. So let's do further on these active cases. As we showed the other time, the chart still shows that the red line, which is the active cases, continues to show a decline, and it dropped to about 12.2% of the total cases that have been done. The recoveries continue to go up. You can see it's edging very close to the total, edging very close to the cumulative total. What is driving the active cases down? And like we said on Sunday, the active cases is the burden that today the nation has to deal with. For example, if I say how many people have had malaria in the last 3 months, I'm sure we'll talk about 1 million people. But how many people have malaria today? And I think that's what we are concerned. And that's why this chart is extremely relevant. If you look at what I showed you, we just continue to update it to see that even the ratio between the total cases and the active cases continue to widen, and that we are now dropped about 12.2%, as I mentioned. So it continues going down, and so the burden is low. But like the minister said, please, this is so because of the things we are doing. If we stop, we'll go up again. We have to continue, even do more, so that this graph will continue and the burden will reduce for us. I think just show you the recoveries in spikes. As you see, you can see so for example, if 800 people were positive 2 weeks ago, a significant number of them who may not be still sick or who may unfortunately have been lost would have reflected in our recovery based on the policy. It's now getting global acceptance everywhere. And you can do that in the weekly basis. You can see the number of recoveries in a week, and these are also very, very important, and we continue charting to show everybody where we are and how we are progressing. I think this is just the age and sex differentiation, and they have almost the active cases, both men and women are the same, but the age ranges, the significant number of them are 18, 20, and 49. That's the active population who are actively working and moving up and down. So it's no surprise that's where we have the majority of the active cases, or those who have recovered. Now, for the active cases we have today, that's the 3,505. Only 18% are symptomatic. The rest are asymptomatic, and that's what reflects in the large number being managed at home. Of the 18% who are being managed at various centers at home and isolation centers, we have 26 are severe conditions, 8 are critical, and currently 4 are on ventilator. Like I said, 82% of all the 3,500 are asymptomatic. So that means that our greatest challenge also rests on the 18% of the active cases, and that is something that the treatment centers and isolation centers are actually grappling and managing to reduce deaths and also enhance early recovery. I think this is also about the same age group in terms of that case. The first one was the recoveries. Okay. Now I think there's the issue of the SHS. I'm just going to talk about 2 of the regions where we had a high number. I can say for a fact that some of the regions like East had 3 cases overall. They had 1. Western North had only 1 positive case. Most of the regions have very few cases. But for Greater Accra girls had 51 confirmed positives. 56, they have all recovered and back to school. Accra High currently has just 1 active case who has not recovered. Is still under care and relation center. Of the cases in Adan, of the 10 cases from Adan Secondary Technical, 7 has recovered. Wesley Grammar, no case. St. Mary's had 2. In fact, Wesley Grammar has 6 suspected cases. They have not confirmed, and so they are just in quarantine. And we have Ablekuma, where the Mary's, where we had 2 cases who are all recovered. For Ebenezer Secondary School, there was 3 suspected cases, 1 confirmed case, and that case has recovered. So it means that there's no problem in the school. When you come to Okanke North, the Ashimota has 7 cases, and the 7 have all recovered. When you come to the Odogono, they had 18 confirmed cases. It's quite recent, and we are waiting for them to recover, but they are all asymptomatic. So of the 96 positives among the Greater Accra schools, which is a large number of schools, which probably account for the 2nd largest population of secondary schools in terms of number, apart from Ashanti region, we had 96 cases and 73 are fully recovered and back to school. That's in the business. We can also talk about Volta region, where we had 1 case from Maoli girls who is on her 14th day. As of yesterday, when I got this update, which means that she's out of school and back to school to work. Dabala Technical had 3 cases. 1 has 1 active case who is also on the 14th day, so she is also going to be, I'm sure she is also out, but that was the 14th day as of yesterday. The rest, Bishop Herman has 17 cases. They are all on their 10th day, or their 11th day today, which means that in the next 3 days, all recover. The good thing, like I said, all of them are asymptomatic. The only few had some mild symptoms that are not moving anything. Maoli School had 25 cases, 10 have moved, all of them have been moved to the isolation center, and we are waiting to see when they will recover. We have Abutia Secondary School, 2 confirmed cases. They are on day 4, and the same for Amfuega Secondary. So, of the 49 cases, a significant number have recovered. Like I said, all the other regions have minor cases. And you can see in the last one week, there have been very few new cases. I would predicted that within after 3 weeks, they are going to have very few cases coming up. Prime Minister, the next station is so what have been some of the actions that we have taken as far as the schools are? All schools have been assigned to health facilities, and health workers are assigned to every school. We have their names, their number, the schools have their names, their number, the district director, education, everything is there, and they have. DHS is working closely with Ghana Education Service to ensure that all safety measures are put in place and are kept in place. The risk communication on safety in school campuses is intensified. We are giving continuous training for teachers and everybody. Outbreak investigation is always on the way, and that's why we're able to pick up positives and quickly isolate them. The psychosocial counseling and support of children and their parents are currently ongoing. PTAs, teaching and non-teaching staff, and trust members gain the reinforced knowledge and address fears or anxieties, and mechanisms have been instituted to allow remote contact between parents and wards if need be. And we are isolating all positive cases outside the campus. As the Honorable Minister said, we also talked about the backlog. Currently, we have on the average about 23,000 samples that are part of the backlog. But the issue is that a sample that is released 2 weeks after sample is taken has very little public health and clinical relevance. And the most important information is that all suspect COVID cases, whether you have your test positive or not, are managed as if you are COVID. And so even for those who are sick, we are not taking chances. We are treating them as COVID, whether results or not. That's why in our treatment centers, we have suspected cases who are in a different section and being managed because we don't want them to be contaminated in case. But until your results can be managed as COVID until proven otherwise. Based on this and the fact that if I'm sick and I'm not sick, I took my sample 3 weeks ago, and it comes that I'm, of course, negative is of no matter. If I'm positive, whatever it is, I have recovered. And even the people that may have contracted me also have through the same recovery. And so, in order not to perpetuate backlog, we are currently going to focus on symptomatic cases. That is, those who come in who are sick, who suspected cases of COVID will be given priority in terms of testing. And that's what was being done when we had a little challenge with the tests. And that's why we're getting a lot of positive, despite the fact that we're not doing full, because we are targeting the high-risk groups and making sure that the clinicals who are likely to be positive are tested. That's why, despite the reduced number of tests, we're getting very high number of positives, and that's why the positivity rate went up. We are going to look at that. We will focus also on the contacts of the confirmed cases. Anybody who is positive, prioritize their contacts. Thirdly, exposed health workers and students will be given priority in our tests. Returnees will also be given priority so that we can also ensure that when they arrive, we test them and then before they are discharged. In all this, we only make special cases for among the backlog. For example, if someone may arrive and we are not too sure whether it was COVID or not, for proper handling, we need to go back. The district will ensure that those samples are identified and tested. And that's what we're going to do. So that is going to be the key driver to our next phase. So we don't want a situation where we are going back to do a lot of this. The tests are, the numbers are presented to you. Some of them date back 22nd of June. That's a month ago. The results really means nothing to the people who have been tested, whether they are negative or positive. And so basically, that will be the policy. We're going to focus on that so that we don't care further backlog, so that within 48 hours, those who are sick are quickly got their results. We will continue hammering on the preventive measures. Wash your hands, cover cough and sneeze with a tissue and dispose the tissue in a closed bin. I think sometimes we forget about this, so it's important once in a while to remind people that. And then wash your hands after you've done that. Avoid touching your eyes, nose, mouth, including pulling the face of your mask with your hand. Hold it like this. Otherwise, you may pick the virus you are trying to block into your finger. Clean and disinfect frequently touch spaces or surfaces such as remote control, door knobs, and your phones. Avoid close contact with people who are sick, and always wear a mask when you are leaving home. When there are circumstances in your own home that you may want to wear a mask. For example, if you have a visitor coming, let him wear a mask and wear your mask until he goes. Okay? I will call all these designated centers. If you have any challenge, the 311 and the 112 for assistance So, ladies and gentlemen, this is what we have for you today. Thank you very much.
Thank you, Dr. Patrick Kumabwai, for that update. Before we take the question, I want to highlight a few of the things that you mentioned in your presentation. Number one, the big number this morning that the Ghana Health Service and the Ghanaian Republic is focused on, the big number is 3,505. That's the big number, 3,505. And I'll be repeating the big number every time we have a briefing, because that's a big number that we are keeping an eye on, 3,505. Those are the active cases that represent a burden on us currently, or that put a responsibility on us currently, which we are managing, 3,505. And as we've mentioned, the focus is to provide the supportive treatment to 3,505 and hopefully have it been down, while at the same time reducing new cases. Because if this is going down and cases are coming up even at a higher rate, then this number is going to go up. But if we reduce the rate at which new cases are coming in, then as we succeed in providing treatment towards recovery and discharge of these persons, we can get 3,500, which is the big number, we can have it going down. And to prevent more cases coming in, colleagues, we all have to keep reminding our listeners and our viewers and our readers of the preventive etiquette and the need for them to observe. But the big number this morning is 3,505. It is because there are about 20,000 persons who have tested positive from the very first day. Over 25,000 have recovered. That is why we have 3,505 as the big number for us. One key part of your presentation that I just want to reiterate. Number two, in this latest update that you are giving us, out of the 559 new cases that are being recorded, it span a period of about, from 23rd June to the 17th of July.
A month.
About a month. So it's not 559 in one day. What it means is that a good chunk of this 559 is not even going to be part of the active cases. Am I correct, sir? Yeah, because they are recovered. But just for the data provision, that's why we are accounting for all of this in transparency. So it's not 559 new cases. The big number is 3,505. But just to provide you the data, the last data they put together, the 559 new cases, and if we can go back to that graph, colleagues, it's from the 23rd of June way down to the 17th of July. And actually, no, that's a bar graph. That's a bar graph after this one.
Slide 5.
Yes, actually, if you look at the numbers, you find it's average about, or even specific, 54 a day, 42 a day, 34 a day, 12 a day, 20 a day, 20 a day, 31 a day. But when you put it together from the 23rd of June to the 17th of July, that's how you come by the 559. So just to put it in context, colleagues, we are all following. Item number 3 that you have mentioned, and even for this 559, it suggests that about 8 regions did not record a case. When you do the breakdown, about 8 regions did not record a case in this latest update. The next one that I'd like to highlight is the fact that active case curve, which represents the real burden on us, declining. And I think under the active case analysis, that was the first thing that you drew our attention to. You also made some time to speak to the fact that only about 18% of our active cases are symptomatic. The remaining 82% are asymptomatic, and they are managed accordingly. And then the good news from the schools data that you've given us is a very high level of recoveries in the schools. So for those who panicked and were suggested close down the schools, the data as is coming down clearly showing that the Ghana Health Service, the Ghana Education Service, the school authorities are on top of the situation. The system that was put in place to protect students, teachers, and non-teaching staff to identify cases and treat them is working. That is how come you have this very high level of recoveries from the few who have tested positive in schools. So, Dr. Badi, we thank you for your presentation. We also thank you for the explanation of how you will prioritize samples when dealing with the backlog, so that you can deal with the more recent or other categories that of clinical and public health significance. Colleagues, I want him to now to step forward if you have questions so that we can get some answers to these questions. Yes, sir. Could you catch my eye first? Madam Kwaku, could you come? I'll tell you a funny story of one of our former speakers of parliament who, when you rise, you can look at it and say, you have not caught my eye, take your seat. Yes, sir, Ghana News Agency.
Yeah, thank you, sir. I want to find out how long does it take for a year to be test sample to go bad? And how are these samples that have gone disposed?
But nobody has said any sample has gone bad.
Yes, I'm referring to the story from the Western region that after the country experienced a shortage of reagents, some sample got bad there. So I wanted to find out.
Some sample got bad?
Yeah, some samples got bad in the Western region. Some laboratories couldn't test them, so it went bad.
As in the labs did not handle the sample well?
Yes.
Okay, so it's not about how long does it take for a sample to go bad?
Yeah, I want to also know that as well.
Very well. Yes. I'll let them respond.
Then how those samples are disposed of. My third question too is I want to find out the storage capacity of the testing facilities. The storage capacity of the testing facilities. And we have a testing site. I want how each one could.
How much sample can they store?
Yeah, they store each
Very well.
of them. Thank you.
Thank you. Ms. Kwaku.
My name is Sarah Parku, Media General. I want to find out how soon is Ghana Health Service anticipating the backlogs to be cleared? How soon are you expecting this 23,000 backlogs of tests to be cleared? And I also want to find out, we've had updates on the health status of some public officials who tested positive. We want to find out the others that have not been mentioned. How are they faring to treatment, like the NHIA boss and deputies, the Kolibu CEO, and others that we knew of their status but haven't had data on how they are faring? Thank you.
I'm Kojo from City TV. Dr. Kuma, please, the data you gave us is different from what I'm reading on the GhanaHealthService.org. If you might want to, active cases 3,370 is on the website, so you might want to update those. And you also didn't tell us the cumulative figure of COVID-19 cases.
She did.
Yeah, she did. Sure. And then also, please update us on the health infrastructure being carried out across the country. We want to know, for example, the Kumasi facility you are building, at what point it is, and then other regions. Thank you.
Thank you. Let me quickly take the matter of the government officials out. I think the government officials who authorized us to announce their status have also given us opportunity to update you on where they are now. The others that you mentioned, I do not necessarily have a brief on what their status is, but I think in past 14 days. And so we can make some presumptions in that area. Dr. Badi, the very first question, I would like you to broaden it a bit. Are there, or what are the conditions under which a sample can go bad? Is it about time or about storage conditions in the labs, etc.? You can give us some education on that. Now, secondly, I think you have to be very clear on this 23,000 backlog. Are you saying that some of them have gone bad and therefore you won't test them, or they are going bad, or they have gone bad after 14 days, therefore you won't test them? I think you have to provide us some clarity, else we may have a tendency to misinterpret what you've said. Please go ahead, sir.
Thank you very much. Samples gone bad. I don't know where you read that. We have ways of storing samples, and they can be kept for years under special freezing conditions. We even still have samples of smallpox, for those of you who heard about it, still available. But if a sample is not taken properly, instead of sputum, it becomes saliva, may not be used. If there's a spill, because it's not handled properly, because you don't know whether another sample may have contaminated a sample. That's the only centrifuge where you can say samples are, but they have very, very good storage facility that can be kept not only for the case, but also for research purposes. So I don't think that anybody said that 30,000 samples in Takoradi has gone bad. The storage capacity varies. They are kept in cold boxes and in freezers, and so I will not be able to tell you exactly what it is, but what I can know is that currently, as at 2 days ago when Prof came here, he said they had a backlog of 20,000 samples there. So that tells you that the capacity is, of course, much, much bigger than that. I'll not be able to tell the exact capacity, but we know that they have the capability to store the samples that we are giving to them now. So nothing is going to get spoiled because there's no space to store the sample. How long are we going to complete the backlog? I've just given you the criteria. We are not going to focus our attention on samples that may not bring of any relevance. And so those who are there for special cases, we are going back. But we will continue working on the more recent ones as we deal with the response of COVID. But those ones that we feel they are relevant, for example, someone had a suspicious death and that they have taken the sample, we want to go and see, was it COVID or not, so that we know how to handle the body, among other things. And so that's the way we are going to do. I will not be able to give you exact, but we'll be working on it, but it's not going to be top priority of the cases. So as we get new cases and we focus on, in time, we'll be going back to look at those things, but I don't think that we're going to focus on the backlog, especially those that are more than 2 weeks old. So that's what I can tell you. I think what I presented to you is a figure as far as the active cases is concerned, and then we'll deal with that later. For the health infrastructure, there are quite a number currently going on. As we mentioned in Kumasi, we have completed the expansion of the Kumasi South from 18 to 35, and they are currently in use. We've been there to inspect. Konfanoshi has also expanded their holding area, take more cases, and then the ICU beds. The Professor Frimpong Boateng's facility, it's about a 90-bed capacity, is ready. Staff have been trained, and they are currently going to start probably tomorrow thereabout, because everything is there. They will start moving patients from Kumasi to the place, and so that one has also been done. What has delayed is the support we are having with KFC in Takoradi, where we are building as an birth center. That was not completed. We are quickly trying to complete. Dr. Akodie and Dr. Belquin and the lab people will go there on Wednesday, Thursday, to see when we can have that done. Last time we talked about the center at Dodowa, which is near completion with we are adding a few ICU beds. We are still testing the equipment at Deborah Ward in 37, and when the testing are done, that will also be available for use. We've also gone to see the Fomena Center, where we know that it's a ward that is nearly ready for use, so that we can always move in when we have any surge. But currently, with the expansion in Kumasi, we do not have that challenge that we had a few weeks ago. So there are quite a number of new facilities. The Upper Hospital will be ready very soon, and these are all areas that we can create spaces for infectious diseases. And most importantly, in the next few days, the 100-bed infectious disease center that was built by the private sector will be launched. It's fully financially is ready, and that we now move more cases from the regular Gan East into the more infectious disease, which has negative pressure and everything that's required as an infectious disease center. So those are some of the key updates that are coming. Currently, because of reduced active cases, because of the number of cases are small, there are many of our treatment centers across the regions that are currently not being used because we don't have any case put in there. So that's the brief I can give you as far as the infrastructure is concerned.
Look, thank you. We will take another batch of questions just to make a few things. So I'm sure you know that there are several times when we'll get the latest update here at this podium, and then our colleagues who are managing the website will then lead subsequently. So you can trust that that will happen. Number two, colleagues, those of you who come to our briefings and get the full understanding of things, we would like to ask you to directly influence the stories that your news portals, etc. write. Even as we are speaking here, we are still reading headlines. That's coronavirus infections in Ghana, now 28,989, after 559 new cases. I'm just reading it right now online. So those of you who are here, who are following the content and everything, we would like to encourage that you speak to your colleagues back in newsrooms who are writing some of these stories so that you can guide them and narrate accordingly. We thank you. There was a hand up here. Yes, sir. 1, Atta 2, EIB 3, and then 4. So let's take these 4. Our big number today is 3,505. So coronavirus infections in Ghana now, not 28,000, it's 3,505. Yes, sir.
Okay.
The 28,000 is those who have ever had it from the very first
12th of March.
12th of March up till now, but 84% of who have recovered. So those with now is 3,505. Thank you very much. Yes, sir.
Yeah,
that's saying.
Me person me find out say na one brand mu say question we dem say e come wan kasa.
Pacho say.
E come wan kasa no.
Ah, okay.
Na one brand mu say ya chimi pe bia on she nose mask na ye be charge on and I say do me to prison ourselves. So see no abane say ya chi amount for na one ti got him na say ye momo bra. Emra na hifa we so chi ye ni the money from the church say a tubia, yes, your money what you want now say, or Prakwan home. It is over in your sign to Chimo. Okay.
Good morning, Honorable. If you put me for Kendall, the question back in relation to the Obisa CCA, this issue about enforcement of marks in any military fire home in Grano. But the Obisa say, only a crap this security forces are more enforcing Brano, and I say Kokumasi be who are other regions in Aswa, the bones of this air Kosumbo and a near Bako. And I'm new year, Ghana Health Service. But with my exact figure, the number of students are Omuna, COVID-19, and Omania recoveries now. So far, that's hold more edge, more Moja in doing they start exams. Almost also arrangement and quack saying I'm almost sabri and no and me and so come Ghana Health Service. There is one public health expert who University of Ghana, a friend doctor I had talk. No chest new discharge policies here about any recoveries no it's now. And no na amount for any doubt or much me and pampa as cases no they are a cost run sign a tiampa. But me and my and I say, what do you make of this new issue of a new discharge policy in recoveries? No,
say no, na
and then amount for any doubt to say I'm pampasing be a arena or home put na air cost room pusa.
Okay.
And the last one, the honorable Kujo upon Kroma. And no, there's this report an AHS attributed to say about Ghana for 20% be or Omunjin be say arena or home. What kind of saying another social?
EIB.
My name is Eric Mawenegbe with Star FM. My question, first one goes to. Okay, I'll start off with.
Eric is the one who can ask like 6 questions at a go. Eric, let's hear you.
It has to do with the issue of compliance.
Yeah.
I think generally there's been a lot of talk about compliance, but in terms of enforcing these compliance, we haven't seen a lot of that done because recently.
You've seen a lot of enforcement.
Enforcement, I should say, because number of pubs myself personally, I've seen open over the weekend there was a funeral in some parts of Accra where a large number of individuals were gathered. So what's the current status in terms of enforcing these restrictions on pubs and the like? Because in parts of the Volta region and the like, I get a message from friends and the likes that people pin pubs and individuals go there to sit and do all sorts of things. Now, the second one goes to the Ghana Health Service. In terms of this new policy, if I can call it that, for the backlog of cases, is it the case that those who are asymptomatic, the samples will never be tested? Because per the understanding that we have, the asymptomatic, they should have recovered by now. But is it the case that the samples will be tested or they will not be tested? If they will not be tested, won't this affect our cumulative number of infected persons and go into the studies that we'll be doing in terms of the trend of the virus and all of that? Those are my questions.
Thank you very much.
Yeah, good morning, Honorable Minister.
Morning.
My first question goes to you. I learned that government has spent the region of about $30 million US for testing. So I want to know how much government has spent so far since this whole COVID started, because people are just speculating that government blowing out the figures or they're not telling the truth and things like that. So we want to know how much has gone to the COVID fight and things like that. And Dr. Patrick Abuaji, you have mentioned the students who have gotten the disease. So far, you have not told us about the tutors, the school authorities, and people who handle the students who have come into contact or who have gotten the disease. We don't know if there's something like that. We want to know. And then you did say that you are going to concentrate on the people who have the disease and other underlying health factors. And those who are asymptomatic are not going to be, sorry, I don't know if that is what you said. If you said so, so are you going to let those who are asymptomatic walk around and infect people, or you are going to quarantine them or put them in isolation or whatever? We want to know.
Okay. He says that you said that you are not going to test samples of asymptomatic people.
No, I didn't say so. I'm saying that I'm going to concentrate more on people who have the underlying health who are very ill. And the asymptomatic, I don't know, if I heard right, you're going to concentrate so much on them.
Yeah.
And I'm asking, if people go out there, are they going to quarantine or isolated, or they're just going to through the system and they infect people?
Okay.
You get me now? Thank you.
Okay, so, Doc, let me just reiterate some of the issues for you, and then I'll take ones that deal with central government. There's a question about the priorities for the backlog.
And so that is the update from the Information Ministry on the bi-weekly news conference as far as Ghana's COVID-19 cases are concerned. Under management, Ghana has recorded 559 new cases of COVID-19. The active cases stand at 3,505. The total tally since March is now 28,989 as of Tuesday, July 21, 2020. The new cases were confirmed in 36 districts across 8 regions. Director General of the Ghana Health Service, Dr. Patrick Abuaji, gave the latest update a while ago at the news conference and said that in Accra, 25,331 persons have been discharged and recovered, for that matter. Meanwhile, we have 153 individuals who have died as a result of coronavirus. So far, 353,752 tests have been conducted since the outbreak of coronavirus, since we recorded our first 2 cases in March 2020. And as of July 21, a total of 23,000 backlog of COVID-19 samples are yet to be tested. And you heard him talk about the fact that they will place much more emphasis on symptomatic cases. So that's it for the update as far as coronavirus is concerned.